Learn about the county's model healthcare plan, convenient family clinics, children's programs, neighborhood and senior centers, transportation services, and more.
Welcome to Hillsborough Health, a series that's dedicated to assuring that the residents of Hillsborough County know about, understand, are informed about the services available to them through the county, through Hillsborough County. I'm Louise Thompson, and with me are some folks who are involved in the eligibility, intake, and the determinations made so that people can get on the health care plan. And they are Morvie Burgess. Welcome. I'm glad you could be here today. Ruth Medina, thank you for being here. And Alicia Baker, thank you all for being here. Well, let's get started right away. What is the health care plan? So many plans out there today. You want to know what the Hillsborough County health care plan is. Alicia?
The Hillsborough Health Care Plan is a managed care program for qualified residents of Hillsborough County.
By qualified, what do we mean, Morvie?
It means that you have to meet the federal poverty guideline. You can't have coverage under Medicare, Medicaid, or any other healthcare, any other resources. We're a payer of last resort.
So meaning if somebody isn't eligible for those other plans, this is where they would go if
Yes.
they're not in the Affordable Care Act too. Is that correct?
Correct.
So they would come to Hillsborough County, and there's a way that they get served. You have to be a resident of Hillsborough County, and there are other things you have to do?
To qualify, you need to be a legal resident of the United States, must be a Hillsborough County resident, must be at or below 100% of the poverty level, as well as you cannot have 3 separate felonies on 3 separate days, which is our 3-strike policy.
How do people apply to see if they are eligible?
The easiest and quickest way is to do that online. The county website is insight.hillsboroughcounty.org. It's actually a 2-step process when they apply. The first part is a screening, so they can see if they appear eligible before they go through the entire application process. If they appear eligible, then they can actually complete their application, and it'll go directly to our intake unit to process.
That's a good idea, having some preliminary things so you don't go through pages and pages and find out, oh, whoops, I wasn't eligible anyway.
We thought so. That way that they'll at least know that they don't need to provide all the other documents that we need to determine their eligibility.
Now, Ruth, if they don't have access to online, how else can they get involved?
We do have some of our caseworkers at local clinics that are available for clients who want to walk in and apply. Some of those clinics include Tampa Family Health Centers as well as St. Joe's Community Care. They have financial counselors available that can help them apply for our services.
Can they phone too? Or just
Yes, ma'am.
Walk in online
They-
and phone?
Yes, ma'am. They can give us a call and we can mail them an application if
And
needed.
what about if they're not English speaking?
We do have bilingual representatives available that can be contacted at 813-272-5040.
How do you get assigned a doctor, or what do you have to do? Get a referral all the time, or how does that work?
Well, once they're determined eligible,
Yes.
in the package that we send out to them, they're given a list of different sites that they can choose. So they choose a primary doctor. And once they get to the primary doctor, the doctor would then determine any kind of specialty care that they need. And so they would do a referral to the specialty clinics.
So are there a number of doctors involved in this program? I mean, do you have ones you choose from, or are you assigned a doctor?
They have a choice. So there are a list, we have a list, and they choose whichever clinic they want to go to, and that becomes their primary site. And then everything is coordinated through their primary doctor.
How many clinics do we have around the county? A lot?
They have enough to choose from.
And they're from in East County and South County and all these areas?
They're countywide. We have some in Ruskin, Plant City. There's some in North Tampa, Carrollwood, New Tampa now, South Tampa. They're spread out all over the county to make it as convenient for people to get in to see their doctor and to get the care that they need.
So these, like Tampa General has clinics, and those are all, everyone that's a Tampa General clinic or a St. Joe's clinic is part of this plan, or just some of them?
St. Joe's has actually one clinic.
Okay.
Tampa General, I believe, has anywhere between 5 to 10.
Okay.
Tampa Family has several spread out through the county.
How does somebody enrolled in it find out about it? They, where these are located, you hand them a package when they first start, or you find the place closest to them, or?
When we send them their enrollment packet after they complete their application, we send several documents, and among those is a page that they can select the clinic of their choice. Some do it by their zip code, by their location. Others do it by what hospital they choose to go to or that's closest to them. Some want to go to a Tampa General clinic, so they would select that. But we leave that up to the customer to select where they want to go.
Morvi, do they pay anything? Do they pay a copay or something when someone who's on the health care plan, do they pay anything at all?
There is for, I think it's prescription, there might be a copay, but
Not for the
no,
doctor's
there's
visits?
no doctor's visits
Now,
copay.
does this cover dental too? Does it cover eye doctors and?
At
like
this
that?
time, dental and vision is not covered, but emergency services for dental would be covered for extractions only.
What other qualifying things are there, or can you tell me stories about anybody that you know of that without this might have been lost in the system? I mean, this is preventive in some ways too,
It is.
because, right, they could have ended up in an emergency room with a very serious condition, correct?
That was the whole idea when this was developed, was to be a preventive tool. And so we get stories all the time. Mostly a lot of people don't know about our program. They find out about it, and you know, this program was here all this time, and a lot of people, you know, they're suffering from diabetes, high blood pressure, and didn't know that this exists. And once they find out about it and they get on the program, you know, their health gets better, they're able to work, you know, they're able to get better. It's a good
Return to a
program.
more productive life. If they were
Right.
suffering diabetes, is a perfect example. If you can't get the right medications, or you're not checked all the time.
Yes, and we hear from people all the time that they're unable to get this medication. It's very expensive, and once they get on this program and then they get their health taken care of, you know, then they're able to have a productive life, and they don't end up in the emergency room, which is very expensive, which would probably cost us even more, which was what was happening before before they came up with this healthcare program.
So this was one of the reasons that they came up with it, to try to
Exactly.
minimize the expense of the emergency rooms and the devastation that somebody has of disease that they can't afford to do anything with.
Absolutely.
Okay, so people with cancer or other things can go on the plan, right? Is there
Oh, yes.
anything that makes them ineligible, or outside of what you just said? I mean, every illness
There's no
can't be treated, right?
There's no disqualifier for pre-existing illness.
Yeah. Do you have other stories that you know of, you know, or examples of people besides diabetes and finding out about that, you know, it helped them a lot?
I think we take it for granted because we see so many daily people that we've been able to assist that didn't know that they had a diagnosis, that they didn't know they had a cancer diagnosis, but were able to have it, they were able to get the diagnosis in time so that they could get the treatment they needed so that it did not become terminal.
So you're saying almost people, sometimes they don't feel well, but they really don't know what's wrong, and they never got to the doctor.
Correct,
And this helps them get to the doctor, get a diagnosis, and so forth.
correct.
Do you find different things happening when you talk to Spanish-speaking people, Ruth, about, you know, their awareness of the program?
I do find that there are certain parts of the community that aren't aware of the program and the services we provide. And the members we do have are extremely grateful for all the services we do provide for them, because it is a great program and it is very useful for them, you know, with the risk of diabetes and high blood pressure in the Latin community.
Things that could go under control
Yes,
if
ma'am.
they see the right doctors and so forth, but things that
Correct.
if are left out of control can really cause serious complications and/or death, right, in some of these cases?
Yes, ma'am.
Okay, so the program is funded. How is the program funded again?
It's funded through a special sales tax, and it's managed through Hillsborough County government.
The sales tax that we pay in Hillsborough County, it goes directly into this program and funds the program, right?
Yes,
Which is
ma'am.
what, a half a cent of the sales tax that we're all paying?
That is correct.
And that got voted in, when did, early 90s, 92?
Early 90s, I think about 1992.
Okay. To explain the eligibility requirements that you talked about, poverty level, what does that mean exactly?
It's 100% of the federal poverty guideline. And so you can make up to that, the household can make up to that and are eligible. Above that, of course, you wouldn't be.
So at the present time, that changes, that number changes, right, over
I think
the time?
annually it changes.
And the federal government decides on what the poverty level is.
Exactly.
And if you fall below what poverty level is, then you are eligible for this program and many others across the country, correct?
Correct.
Okay. The fact that the county is not able to get the word out as much, and it's one of the reasons we're doing this show, I think it's very difficult for the county to get out all of the services that it provides to all the residents, and then it has to be repeated over and over. And so what I guess we're hoping for is people who watch this show tell people in their neighborhood or their relatives and so forth, or share it on the social media sites, or we'll put it on Facebook or Facebook or YouTube, and maybe they can forward these things so that more people are aware of it. You have a call center, is that how it works, where people can call in?
Yes,
Are
ma'am.
there a lot of people available to answer the phone?
Yes, ma'am. We have several agents available, and we're open Monday through Friday from 8 to 5. We also do callbacks on people who call after hours. We're able to contact them within 24 hours.
So they get an answer pretty quickly?
Yes, ma'am.
Monday to Friday, 9 to 5, call the number, which you gave that number before?
Yes,
You want to
the-
repeat it?
Yeah, not a problem. It's 813-272-5040, and just select option 5 and someone will assist you.
Do people have a case manager per se, who watches out for, what's happening with the people?
Yes.
Or is it the general physician, or is there like somebody outside of that?
Okay. The actual eligibility part
Uh-huh.
is through the county. They each client or each customer is assigned to a case manager, and the person who determines, the staff member who determines eligibility, that person would be responsible for that case as far as eligibility is concerned.
Okay, so they will watch that all the paperwork is in that is necessary, for example, residency, verification.
Assets.
Do they have to provide W-2s or
Well,
their
Okay.
tax returns or something?
Income is determined, we look at the last 30 days' income, and income is anything monetary, any fund, could be paychecks, pay stubs, gifts, if you get ongoing, Social Security, disability, unemployment, comp, anything, any income is counted. And that's done, it's based on the past 30 days.
Oh,
income.
so
if you
therefore,
fall-
if you were employed the year before you applied, but then lost your job and lost your benefits and so forth, they're not going to count the money you were making
No.
last year. So it's only the last 30
The
days. I
last
think
30
that's a
days,
really
yes.
important fact to get through, because that's when you really could get in trouble. Even with COBRA or any of that, it's good for 30 or 60 days. You have to hurry up, right?
Okay, so we look at the last 30 days income,
Yes.
but once the person's, well, we look at the income and we look at assets. So there are other things we look at as well.
Okay.
Because asset, you do have an asset guideline, so you can't be over a certain amount.
So you can
And
own a
that's like
house maybe, but,
You can own a house. Your homestead is not counted against you. But if you have extra property, that is extra asset. So that could be counted against you. So it's assets, CDs, savings. You can't have more than a certain amount. But once we determine that you're eligible and you're placed in the healthcare plan, then you're good for probably, I think it's up to 12 months now. And then there's a recertification period. So we look at the case again. We look at your income and asset and all that periodically. That's probably every 12 months right now, and to determine if you continue the program.
and do you have to re-enroll, or is it very automatic, or how does that work?
You would be re-enrolled at that point as long as you are still eligible for the program. And then it would continue for the next period that you're eligible for. If we get to a point where it looks like you're no longer eligible for the program, maybe you found a job now, maybe you got approved for Social Security, or your income has gone above our guideline. We do offer other resources. Right now, we have the referral to the Affordable Care Act if they are over, as well as certain clinics that will see them on a sliding scale. So we're not going to just tell someone you're no longer eligible for our program. We want to make sure they continue to get the care that they need.
Can they continue to see the doctor they had under the plan, or not really? They could go on a different plan?
You mean if they were found no longer eligible? They can. Most of the clinics will continue to see people on a sliding scale if they're no longer eligible for the program.
Okay. So the program's good for, once you get eligible, you know you're set for the next 12 months unless you get a job or other insurance. So you have some security, correct?
Yeah, and I said 12 months, but it's, it could be, because something can happen between the time you're enrolled and 4 months from now or 6 months from now. Somebody could have, you could have won the lottery or you could have.
Okay.
And so, it depends on.
How would people find out about that? They either tell you about it or somebody lets the county know if you became ineligible?
We ask them to report any changes to us just so we can take a look at it. Sometimes the changes won't affect it, but sometimes if they do have a job, maybe they've gotten insurance on their job. And again, with the county being a payer of last resorts, if they have insurance on the job, we definitely want to make sure we're aware of that and stop their county coverage.
How long will this tax be in effect? Do we know that it'll continue for a long time, or does it get renewed, or what happens with the sales tax that funds the program? Do you know?
I know it's been renewed, but I'm not sure when.
What the length is, whether it's a 10-year, 20-year, or something like that. So there's money in there to take on new people, as long as we all keep spending money and jacking up the sales tax revenue, correct?
I know we're currently enrolling new people.
So we have the money to do that. So residents should not be hesitant to give you guys a call and find out whether or not they're eligible, or maybe a parent or some neighbor might be eligible. This would be, sort of a gracious act to not let somebody know that's in poor health or just needs preventative care to get involved. Are there many children enrolled in the program too, or is it for just adults?
It's typically just for adults. Under very rare and special circumstances, I've heard of some children being enrolled, but for the most part, it is for adults.
That would come under other programs. I think the state runs.
Correct. With being a payer of last resorts, most children would have either Medicaid or kids' care, so they would normally have other coverage, and that's really the reason they're not on the county's program.
What do you think people are least aware about in the program, and maybe you can tell our audience what they might be the least aware of? I mean, I know they're not aware of the plan itself in many cases, but are there other factors that are generally myths about the program that maybe people don't understand that you have an opportunity to maybe correct?
I think the biggest thing is not knowing about us. you still have a lot of people who do not know we exist right now. And getting the word out like we're doing, I think is going to be really helpful to the community. A lot of people don't know we cover prescriptions. So once they get in, sometimes they'll ask us, do you cover prescription as well? And then we have to explain, yes, it covers just about everything.
So they're not aware that they would also have their medications covered.
Exactly.
And that may be the first driving motive, reason for needing it, because medications are not cheap.
Correct.
They're very expensive, and if it's between paying the rent and getting your medicine, I guess you'll pay the rent. All right. Do you want to add, do either of you want to add to that?
I think that Morvie said it perfectly. I also think, like you said, the hardest part is just getting the word out so people know that we are here. Your health care is covered 100% once you're enrolled, other than your $1 copay for prescriptions. So once you see the doctor, there are no copays. If you need to see a specialist, there are no copays. The goal is to make sure that you are healthy and can be productive. And that's the main goal.
Something that would be very beneficial to residents to know is that we also not only cover just medical appointments and specialist appointments, it does cover chemo, big things, surgeries that are medically necessary. And a lot of people enroll and think it's just for preventative care. It's not. We also do assist with things that are extremely urgent.
And very expensive. Chemo and
Yes,
radiation
ma'am.
as well,
Yes, ma'am.
and the surgeries. And if you broke your arm,
Yes,
or
ma'am.
like that, it's not just, hi, I'm going to give you an exam. I'm going to
Right.
take care of whatever your problem is. And ongoing with these diabetes situations, you have insulin, you have pumps, you have meters, you have all kinds of things, and those things are covered.
Yes, ma'am.
So we've got to get more people informed. Any things that I didn't ask you, I think we only have a minute or two left, that you want to make sure you convey to the residents about the plan?
I just would like the residents to know that it's very easy to apply and that it's very easy for us to determine your eligibility. And if they are in need of health care, to please visit the website. And again, that's insight.hillsboroughcounty.org. And then we can take care of their eligibility and try and get them the services that are available in Hillsborough County.
ASAP.
As
Right.
best we can, yes, ma'am.
ASAP. All right, Ruth.
If the clients are found ineligible for our program, we do have other resources that we could give them that may be useful to them as far as the clinics that are available on a sliding scale. And there's also different programs that are available through the county that may be able to help. So we're definitely a great resource for the community if they're needing assistance, not just medically, but sometimes financially as well, and other resources for...
We're going to cover some of those other programs
Yes,
later
ma'am.
on, too. Morvie, did you want to add something?
Just even if you think you're not eligible, you should still apply. Sometimes you're very close, and some people are turned off by the fact that they may look at it and think that they're over the income guideline, but we go by net income. So if you're not sure, just apply.
Oh, not gross income, by net income.
Net
What do you
income.
end up with at the end of the day?
Right
That's
after
where-
taxes.
And that's where the
Sorry.
federal poverty guidelines come in, with the net income,
Well,
not the...
there's a poverty guideline, but we look at the net income. There are other services within the county that looks at gross.
Well, I think you've all been such a great wealth of information, and I appreciate your coming down to talk to the residents of Hillsborough County, letting them know more about the health care plan that so many of us really don't know about, that we have this real gem in our community and people that are very concerned administering that program. Thank you for what you do. Thank you for tuning in, and we'll see you next time on Hillsborough Health.
Health.